Okay, Jacob, go ahead.
All right, the Respiratory Therapist and Polysomnographic Technologist Licensing Board meeting is convening at 9:02 a.m. on March 18, 2022 at the Health Licensing Office in Salem, Oregon, and by telephone conference call. I will now call roll. Jacob Espinosa, aye. Sarah Fitzpatrick.
Aye.
Mark Easby.
Aye.
Pablo Herrera Fuentes.
Aye.
Okay, members, when you wish to speak, please state your last name for the record. For the record, public members calling into the public phone line are asked to email April Fleming at april.fleming@dhsoha.state.or.us and provide your first and last name. Public and interested parties' feedbacks may be heard during the public and interested parties' feedback period if indicated on the agenda. Everyone is asked to use appropriate language, manners, and protocols when conducting board business. The meeting is called to order.
Okay, so this is Sylvie. So we're going to amend the agenda today. So today we are not going to do item number 5 nor item number 6. So if someone could make a which is an executive session, which is item number 5. Item number 6 is items for board action, which is regarding to complaints and deliberate on contested cases. So those two items will not be discussed today's board meeting. We will make an additional board meeting to address those. So if somebody could make a motion to approve the amended agenda.
This is Fitzpatrick. I make a motion to approve the amended agenda.
This is Herrera Fuentes, and I second that.
Okay, a motion has been made to amend the agenda. I'll call roll. Oops. Jacob Espinosa, aye. Sarah Fitzpatrick.
Aye.
Mark Easby.
Aye.
Pablo Herrera Fuentes.
Aye.
Okay. Motion has been passed. Agenda has been modified.
Okay, so this is Sylvie again. On the agenda in your materials, let's look at and discuss the temporary rule that we're going to put in place, and I'll kind of explain why, and hopefully you've had a chance to read it. What we'll need you guys to vote on today is the rule and then the rule schedule. But the intent is that respiratory therapists who are licensed in another state under the state declared state of emergency for COVID have been, we have an office rule that allows for during a state of emergency for licensees to be able to come in and work in this state if they're licensed in another state. However, that state of emergency is being lifted by the governor as of April 1st. So what we're working on is allowing those out-of-state, and it's only respiratory therapists who are out-of-state who are already have been given, who've already met the requirements in order to get the license to be able to work here now, or the authority to work here now, another 90 days to work after the state of emergency is ended, because obviously hospitals are not quite back up to the way they were pre-pandemic. So it's just a rule. And so we're still working on it. We were actually working on it this morning. And so it's changed a bit from what's in your materials. But the intent of that rule is be very specific for those individuals who are already here and approved and working. They get another 90 days. And they don't qualify for that 90 days under our state of emergency rule, because the state of emergency rule is null and void once the state of emergency is no longer a state of emergency. So Sammy is working on creating a rule along with Heather and me that is very specific for that 90-day period. So just know that it's going to be a temporary rule and it will never be filed permanent. So temporary rules last for 180 days. So it's obviously more than enough time to cover the 90 days that we're specifically talking about. And then it will just expire and go away. That makes sense? Okay, so let's go through a little, and Sammy's on, she can talk a little bit about some of the changing of the words. So I'm looking in your materials on slide 7, and this is where we were talking about the limited license. We're trying to make it very clear that this is only for the 90 days. There's no fee for it. They will have to fill out some paperwork, and they will have to give us some more information in addition to what they had given us previously. We'll articulate that with them, but it's qualifying to be able to work in Oregon through a different pathway. So they do have to resubmit some information, especially if their letters or their work agreement with the hospital was, quote, during the state of emergency. They're going to need another letter or another work agreement in order to continue that for the 90 days. So little things like that. Does anybody have questions on what I've said so far or any concerns?
This is Fitzpatrick. I have a question. This statute or whatever you call it, rule, if you have a temporary license out of state, are we this? Okay.
Yeah,
And
so
do
go ahead.
Oh, and then I was just curious, how many licenses are we actually, do we know, how many are we actually talking about?
So last time we counted, I think there was about 350 individuals who had applied for during their emergency clause. And mind you, not everybody has been here that full 2 years. It's basically anybody who, so that's all the people who had applied. It depends on, what hospitals need them, what units need them, So for that 2-year period. So this is only individuals who are currently working. So I wouldn't really know how many are currently working because that's kind of, between the hospitals and them. We have authorized them to be able to work during the state of emergency. So whether they're still doing it or not, we wouldn't necessarily know without having to go through and start emailing and all that kind of stuff. And the hospitals and us have been communicating back and forth because they keep asking, we still need them. Even though the state of emergency is getting ready to lift, we still need them. And then also the governor's office is, because it's not just respiratory therapists that the hospitals are needing. So there's us, the Board of Nursing, the Board of Medicine, several other different boards are implementing some sort of rule that's similar so that they can continue for the 90 days. After the 90 days, they'll have to have a normal Oregon license. Any other questions, comments, concerns?
No concerns. I just want to say I appreciate that because it does help all the hospitals in need.
Okay, so the rule, Sammy, we're gonna have to. The rule is not, the current rule that we've been working on is not exactly identical to what's in here. So how do we want them voting on the rule? Do you want to go through the changes or?
Yeah, what we've contemplated this morning was basically putting a time frame. Hold on, I gotta get there. So it would be under number 3 of the first rule, notwithstanding any other rule or date that the office issues a limited license becomes current and active authorization on the day the declared emergency related to COVID is no longer in effect. Limited license becomes null and void 90 days after the end of the declared state of emergency. And this came from me what-ifing the rule to death. Like, what if this happens? What if someone asks this? So this is basically corralling that it's only the 90 days from the last day of the state of emergency. And then I believe we're also going to allow people to apply before that. So like March 28th, I think it might be the day that we're going to do it. So that may also be added. And I think that was the biggest change. Yeah, those are the 2 biggest changes. Just corralling the timeline, that when they can apply and then how long they actually get the license for, which is 90 days.
This
Yeah,
is Fitzpatrick. So did you say like the last day to apply for this would be the March 28th? Is that what you said?
No, we'll open it up for applications on the 28th rather than the day the state of emergency ends. So people have some time before it ends.
Oh, okay. Open it up to get a permanent license. Is that what you're saying?
No, so
I'm not tracking.
State of emergency ends April 1st. And the way it's written now is it says on that day you can apply to get a temporary license to work limited. And we're going to open it a few days before.
Temporary license. Okay.
Yes.
Yeah, the goal is to let them apply as soon as we're ready. That's why we're scrambling, and I didn't want to cancel this meeting because we've got to get this moving. We're scrambling because there's so much that we have to do, like rule writing. You have to file it with Secretary of State. You have to go through the whole process. We're trying to do it as fast as we can so that people know it's coming. Well, they already know it's coming because we've told them, but they can see it. They can start getting their paperwork together and then they can apply, just knowing that that license doesn't become active until April 1st, which is when the state of emergency is over. And then you get 90 days from then, not when you apply. So like if you apply early, it doesn't start your 90-day clock. That's what we're just trying to be very clear on that so that, you know, that people understand. Okay. So if nobody has hit issues with that, we need somebody other than Jacob to approve the amended temporary rule along with the rule schedule. And somebody can say so moved.
This is Fitzpatrick. I'll move to approve the temporary rule and timeline
The temporary rule as amended.
as amended and timeline.
This is Herrera Fuentes, and I second that.
Okay, very good. Well, a motion has been made. I'll call roll. Jacob Espinosa, aye. Sarah Fitzpatrick,
Aye.
Mark Easby,
Aye.
Pablo Herrera Fuentes.
Aye.
Very good. Motion has been passed.
Okay, so now we'll do some speed reading. I'm just kidding. All right, so I'm on the materials under director's report, so I'm on slide 9. We've already talked a little bit about it, but just a little bit of update on the COVID-19 stuff. As you guys all know, the indoor mask mandate was lifted. However, that does not include medical locations. And it's not just hospitals, but any kind of medical settings, and it's defined in rule. April 1st, the state of emergency is lifted, and then May 1st is when the governor has said that state offices can reopen. So we will open back up to the public on May 2nd. The 1st is a Sunday. So we'll open back up to the public as long as nothing changes between now and then, back to how we were pre-pandemic. So little updates for us. Other than that, let's move on to your statistics. And I'm on slide 13. So this just shows licenses issued. And in here, you'll see a provisional COVID. So if you guys remember, we adopted a rule, we meaning you guys in the office, a rule that's specific to respiratory therapists who had let their license go inactive or expired, but they were in good standing when they did. So whether they retired or they just chose to not renew, whatever. So that's that provisional. This is not the provisional, is not the one for out-of-staters. They're under a different rule that is not a rule within your guys' administrative rules. Does that make sense? And so you can see that there's 6. So quarter 4 of fiscal year 20, there was 5 issued, and then 1 in quarter 3 of fiscal year 21. So that was 6 total. There's only 1 of them that's still active. So that's what that is. And those out-of-staters are not in here, just so you know. Next slide shows the renewals. So online versus paper for respiratory therapists. And then next slide is the same information, but for polysomnography. And then slide 16 shows broken out by age and gender for licenses for respiratory therapy. Next slide shows the same information, but for polysomnography. And then your licensing trend. So this is over a long period of time. You can see the top one is respiratory therapist increasing. You can see a jump there in that 2 years ago. It's just keeps rising. However, polysomnography has gone the opposite direction. So hopefully that stables out and doesn't continue dropping. All right, so now I'm on slide 19. This is the financials. And so anybody who's renewed their license in the last 2.5 months will notice that their rates pretty much doubled. So remember, your fees went up effective January 1. So anybody renewing after January 1 pays the newer rate. And you can see why we had to increase the rates, because your net operations, and your cash balance are in the negative. We've got to get that fixed. Once we get you guys stabilized and get the revenues up to where they should be, and you remember, you want to have a good cash cushion balance so that if you do have a case that goes to a hearing or anything that, like that, starts getting expensive. But once we get back into the positive on the good part like that, then we can write into rule some sort of discount for renewing online and kind of get your revenues and expenditures to equal out again. But we've got to get that ending cash balance back up in the positive. So it'll take a bit, but we'll get there. Any questions before we move on? No? Okay, so Bob, we are on the regulatory report. I'm on slide 21. And you're on mute.
I'm gonna start talking on mute. I'm good at that. Anyway, so as you see in the report, we've got 3 open cases from 2019. I've got 2 investigators working on those to get them off our plates. And on top of that, we've hired a new investigator. So rest assured that we're not being negligent with them. The cases that we're trying to bring to you today rose to the top as far as case priorities. And I know they've been out there for a while, and I've got all kinds of things that sound like excuses, but priorities. So there's 3 in 2019, and hopefully when we meet again, we can have those off our plate. 9 from the 21 biennium and 6 in this current biennium, with a total of 18 left open. Questions or concerns about any of it? Okay.
Okay, so this is Sylvia again. Bob, can you see, so we're on the agenda on item number 4. Can you see if there's anybody on the phone line?
There's 3.
Would anybody, don't let them speak yet, but does anybody want to make a comment?
Is there anybody on the phone that would like to make a comment? Am I muted? Hi to all the participants on the phone. Is there anybody that would like to make a comment? Hearing nothing.
Hearing nothing. All right, well, we will move on then. So we are on other board business, which is used to be number 7, which is now our number 5. Does anybody have any other board business that they want to bring up?
This is Fitzpatrick. I have one comment. I don't even know if it's for this board or not, but I'm going to throw it out there. With the staffing crisis for respiratory therapists in the state of Oregon, I have huge concerns with our travelers and the fact 90% of the travelers I'm seeing are traveling within the state of Oregon. They're quitting their full-time jobs and traveling. So my travelers are from Eugene, Portland, Corvallis, you name it. My staff is quitting and going to Portland, Eugene, Corvallis to travel. So I just think it should be looked at and addressed. And if there's some ethical concerns around this, and I don't know if other hospitals are feeling this, I'm sure they are, because I've had some managers reach out, but essentially all of our staff are quitting just to work as travelers and travel around the state. So I don't know what we can do about it. But I did want to throw it out there that I personally don't feel like we have a lot of out-of-state travelers coming in to help us. We're just shifting bodies around the state. We're just following the dollar, essentially. So I don't know if the other hospitals feel that way, but it's interesting, to say the least.
So I have information on that. Oh, sorry.
I was going to, Espinosa, I was going to say, Sarah, that it's the same thing over here in Central Oregon. I've never heard of a time where we've been contracting phlebotomists, but we've gotten to that point. Like, it's been contracting RTs and everything. So yeah, I get it.
All right, anybody? I got some information if nobody else has a comment. Okay. So we just went through a short legislative session, and during that session, Senate Bill 1549 came up. So if you're interested, you can go and listen and do some research on that. But it's basically a bill that was brought forward that would require all temporary staffing agencies who use medical staff, medical professionals, you know, and send them out. Those staffing agencies would have to be licensed. And then there was also discussion, which it kind of changed, you'd have to listen to all of it, about putting rate caps on. And so that would do the capping of rates. So the intent is that, you know, you can only get so much when you do your temporary versus, you know, because it's this exact same issue that Sarah was bringing up, is that's happening with nurses. It's happening with a whole bunch of other places. The group that brought it forward is they're in, what started it was your like nursing homes, residential care, where the clients are on a fixed income. And so, and they also have to have a certain amount of nurses on staff, depending on how many beds they have. And so they were instantly hugely financially affected by it, because they can't just charge more for their clients because their clients are on a fixed income. So some of these places were shutting down because they couldn't afford a nurse, and the nurses were leaving and they were going and traveling because they're making way more money. And so that's what brought it forward. Obviously the hospitals were affected by it too, but not quite as much. And the hospitals are able to obviously charge more and pass the, you know, obviously nobody wants to, but you're able to absorb the cost a little bit more. And so that was a very hot topic during legislative session. The rate capping piece of it was pulled out because there was too much controversy on it. However, OHA, not us, but a different office of OHA, has to do an evaluation of that and report back to the legislation in December. So there will be a report that has to go back to them about the rate setting. And it's not just for nurses, it's for healthcare providers that go through these temporary staffing agencies, which is what Sarah's talking about. And so our office, got the part about licensing the staffing agencies, but we don't start licensing them until July of 23. So we'll know more about the capping and how that's going to work and if it's going to happen, if so, how much, all that kind of stuff. We should know more in December. So Sarah, remind me about it when we get closer to that, because right now it's in the quote research stage. So
Thank you.
I hear you. It's not just you, it's a whole bunch of other, yes.
Can you repeat what the number is on that Senate bill?
Sure, it's Senate Bill 1549.
Thank you.
Absolutely. All right, anything else? No, okay, so we will, I know that Pablo needs to get going here, so we're gonna send an email. Please be specific on timelines and amount of time. We'll try and estimate how long we think that executive session will take, but we're flexible. It does not have to be on a Friday morning. So when you get emails, we'll give you some dates and you can, anyways, April's gonna get a hold of you and we'll try and schedule something so we can address those couple cases, okay? All right, so Jacob, you do have a closing script.
The Respiratory Therapist and Polysomnographic Technologist Licensing Board meeting is adjourned at 9:26 a.m.
All right, Nathan, you want to turn off, or April, whoever's doing the recording, turn that off, please.